Ladies and gentlemen, welcome to today's podcast at MedSynapse, a leading platform dedicated to knowledge exchange, fostering collaboration, and innovation in the medical field. I'm Dr. Nigar, your host for this discussion. Today, we have the honor of welcoming Dr. Banshi Saboo, a highly esteemed expert in the field of diabetes care. As the Chief Diabetologist and Chairman of the Diabetes Care and Hormone Clinic in India, Dr. Banshi Saboo has dedicated his life to combating this health condition. His PhD in phenotyping and genotyping of young diabetic patients in India has provided him with a profound understanding of the complexities of diabetes. He has been honored with fellowships from prestigious institutions such as the American College of Endocrinology, American College of Physicians, International College of Nutrition, Royal College of Physicians, and the National Academy of Medical Sciences. His contributions to the medical field go beyond his clinical practice. Dr. Banshi serves as the managing editor for Sadiqot's International Textbook of Diabetes, and he is also an advisory board member for renowned journals such as JAPI, Journal of Diabetology, and JOMR. Dr. Banshi's impact and leadership have been recognized with honors such as the Most Impactful Healthcare Leaders Award by the World Health and Wellness Congress.
Thank you, Dr. Nigar, for your kind words of introduction.
Thank you so much. Before we dive into the topic of type 1 diabetes care, we would like to ask you a personal question. What inspired you to dedicate your life to helping individuals manage and overcome diabetes?
One is that I don't have direct sufferer in my family for type 1 diabetes, but I have seen during my childhood and then in my early adulthood and when I was doing my medicine, the type 1 diabetes, the children with diabetes, they were the one by seeing them and taking them injection and insulin, and then they are not taking care of themselves properly. And then I was also seeing them during my early medical days. They are dying because of the complication. And that was the one reason that I took a challenge that I will be increasing the awareness. I will be talking about the diabetes. I will become diabetologist and will primarily take care of these children. We also decided during that time only that those patients who are poor, those who can't afford, we would like to see them regularly on a free consultation basis throughout their lifetime. And plus, those who can afford, we will also take care of type 2 diabetes patients. But type 1 diabetes had become my patient from those early days of my medical life and even before that also.
Thank you so much for giving us an insightful answer on your reason, Doctor. Now, let's begin with our interview. The first question, could you please provide an overview of type 1 diabetes mellitus and its underlying causes?
Complete overview, if you just some patient wants to understand. There are two varieties of diabetes. One is type 1 and type 2. Type 2 diabetes is primarily insulin resistance followed by beta cell failure. So in general, we see the patients with type 2 diabetes, they are obese, overweight, centrally obese, and they develop diabetes in their 30s, 40s, 50s, depending on how much they have obesity and the genetic or family risk factor. While type 1 diabetes is a primarily autoimmune diabetes where beta cells get destructed, they develop diabetes in their early 20s or in their childhood. They develop diabetes with a sudden onset with a significant weight loss. They develop all insulinopenic symptoms and they have to remain lifelong on an insulin therapy. So there is a significant difference between type 1 and type 2 diabetes. There are two varieties of diabetes, completely need different treatment. Type 1 diabetic patients need a treatment where they have to take insulin therapy lifelong. While type 2 diabetic patients, we start with lifestyle modification and the oral medication, which are insulin sensitizer, followed by the molecules which can decrease their insulin resistance, and then we give the medicines like which can increase the beta cell insulin secretion too, like GLP based therapy, or we give them sulfonylurea. But that does not mean a type 2 diabetic patient does not require insulin. With long-standing type 2 diabetic patients, they also need insulin therapy for their control of diabetes too.
Now, moving on to the next question, How is type 1 diabetes mellitus diagnosed, and what are the key clinical features that distinguish it from other forms of diabetes?
As I told you, there are two varieties. In the type 1 diabetic patients may have a sudden onset. Within 1 month or 2 months, they will complain of significant weight loss, polyuria, which is mean more urination, polyphagia means they want to have more water, all the feel that thirsty. And these are the typical symptoms of type 1 diabetes, which is osmotic symptoms, we call it in our medical language. It is because of insulin deficiency. Some patients, they develop directly diabetic ketoacidosis, which is a severe form of diabetes where they have to get admitted, that is diabetic ketoacidosis. And some patients may have a slow growing type 1 diabetes. It means the symptoms will not be like abrupt symptom, but they develop diabetes and simultaneously they also start developing weight loss and other symptoms too. So in these three forms, these are the type 1 diabetic patients who are developing, but most of the time they are symptomatic. While type 2 diabetic patients are accidentally diagnosed, it means they don't have any symptoms. They are diagnosed while getting their sugar because their family member is diabetic. They are diagnosed because doctor is saying that get your sugar test up, or they are diagnosed when they go in hospital for some other problem and their sugar is being detected. So type 1 diabetic patients are abruptly having symptoms and they are diagnosed with the some symptoms, and patient goes for those symptoms to the doctors and doctors diagnose that you are having.
I appreciate your answer, doctor. This understanding is crucial for accurate diagnosis and appropriate treatment, of course. Now, moving on to the next question, can you discuss the importance of early detection and timely management of type 1 diabetes mellitus?
As I told you, if people with type 1 diabetes are early diagnosed, then they will not land up in diabetic ketoacidosis. Diabetic ketoacidosis is a condition which can be lethal, which can be fatal. And a person with diabetic ketoacidosis requires emergency hospitalization. So early diagnosis means these are the persons who can be diagnosed with the earliest symptoms of weight loss, polyphagia and polydipsia. So if any child who starts urinating more or even bad wetting in the night time, or he starts feeling more weak, or suddenly the parents start feeling that now he is losing the weight, or his diet suddenly increase and he is asking more and more water. These are the early signs and they should be immediately, they should go to the pediatrician, or if an early adult, they should go to the physician and the sugar should be checked out. So the early diagnosis will prevent them to develop diabetic ketoacidosis, which can be a serious condition. And second problem is with these children, if they are diagnosed early, they can be educated more efficiently because they don't have diabetic ketoacidosis, and their early treatment will give them a better control of diabetes. And some of the children will have a good beta cell that will also have a good control of diabetes for a longer period of time.
When it comes to treatment approaches, what are the primary treatment approaches for type 1 diabetes mellitus, and how do they differ from those used for type 2 diabetes?
Type 1 means 100% insulin therapy because they are insulin deficient, and that's very important to understand that they require insulin only. Now insulin we give, there were two varieties. One is a basal insulin which is to be taken long acting insulin, while there is a one other variety which we give short acting insulin which is to be taken before meals. It differs from type 2 diabetes because for type 2 diabetes we start with lifestyle modification and metformin, which is an insulin sensitizer, because primarily their problem is insulin resistance, and those patients who develop after the insulin resistance still sugar is not controlled, the insulin sensitizer we had given, we give them sulfonylurea, we give them DPP4, we give them GLP based therapy, we give them SGLT2 inhibitor, but sometimes they may require insulin also for their good control of diabetes. But for type 1 diabetes, it is insulin, insulin, insulin. Now, we have long acting and short acting, but better than that, if we can have our patient who can afford, we can give them insulin pump also, where continuous insulin can be given subcutaneously, and that what we call is continuous subcutaneous insulin infusion pump, which is a choice of therapy for type 1 diabetes.
Thank you, Dr. Banshi. Your explanation was really helpful. It's important for us to tailor our treatment strategies to each patient's specific condition. Now, the next question is, could you explain the role of insulin therapy in managing type 1 diabetes mellitus?
So it is the insulin deficiency. So if you don't give the insulin, insulin is life-saving for them. If you will not give the insulin, they will continue to lose weight, the symptoms will increase, then they will develop diabetic ketoacidosis. If someone is not given even insulin during diabetic ketoacidosis, also the child will have go in diabetic coma, and even insulin is not given, they will die. So before 102 years, when 1921 insulin was not discovered, these children with type 1 diabetes or anyone who develops diabetes which is type 1, they will all die. Now after giving them insulin, what will happen? As insulin is 100% deficient, as I told you, insulin is a life-saving hormone. When we start giving them insulin therapy, it acts and the glucose starts going again in the cellular level, in the cell itself. Cell again starts surviving, and a person will take insulin and will also have a normal glucose level, which will give them a normal life. At the same time, by giving insulin is not sufficient. We have to educate them how much insulin they need and how much sugar they have to control. They have to continuously monitor their sugar, and they have continuously to take insulin accordingly, and that will give them a good life. And good means a long without any complication, a long life without any complication. That's what we want to give to them. And for that, a good insulin therapy and a good diabetic self-management education is required for type 1 children.
Are there any emerging technologies or advancements in insulin delivery systems that are improving the management?
Very, very interesting and very important question, because since last 25, 30 years, we started using them insulin pump. And then simultaneously, there is a continuous subcutaneous insulin pump, along with there is a glucose monitoring system. That's a device had also come. So a child has to do, or a person with type 1 diabetes, otherwise 4 times you have to check your sugar. But now you have a continuous glucose monitor, and now you have a system by which you can give continuously insulin also. Now this technology improved so much so that it had come with an artificial intelligence system. So now latest system which had available all over the world is an insulin pump along with a continuous glucose monitor. They talk each other. So your sugar is first monitored through your continuous glucose monitor, and simultaneously when you take the insulin, that insulin is decided as per your glucose reading, and that gives you continuously insulin, and your sugar remains 24/7 under good control. So this technology has really revolutionized the treatment of type 1 diabetes. Now they need not to check their sugar multiple times, and they need not to bother about how much insulin they have to take, because everything is taken care by the AI system, and that gives them a very good control, and they may remain very healthy, and without any complications they can have a long-term survival.
Thank you so much, Doctor, for providing us with your insightful answer. It was very interesting. Moving to the next question, how do you approach individualizing treatment plans for patients with type 1 diabetes mellitus, considering factors such as age, lifestyle, and comorbidities?
So first and foremost important thing, Dr. Nigar, is particularly when I'm practicing in India, the first thing is socio-economic status. That is most important, because that decides what therapy I can offer the child. Whether that child or the family is not able to afford the even insulin, we have to think of providing them insulin free of charge from some foundation. If child is affording, we give them more better glucose monitoring devices, and then continuous glucose monitoring. If they can afford better, then we give them newer technology like insulin pump therapy also. So first and foremost, individualization depends on the socio-economic status. The second important thing is the child age or the adult age. That also decides, because then the level of education is more important, because how much they are able to understand the type 1 diabetes, and that also decides your therapy. That also decides their how frequently they have to. The other comorbidities which may be there in type 1, like they may have thyroid, they may have obesity, they may have underlying other problems also, that may decide some sort of a minor changes in therapy, but it is not much major, because type 1 diabetes means insulin. But comorbidities like complication, they have already developed kidney failure, they have already developed retinopathy, the eye problem, then yes, definitely the therapy will be also individualized for these children or these adults who have developed the complication.
Dr. Banshi, can you discuss the importance of glycemic control and the target ranges for blood glucose levels in patients with type 1 diabetes mellitus?
So target range for type 1 diabetes is 70 to 180, with more than 70% of the day should remain between 70 to 100. And that's what we call is time in range. So they should be in time in range for more than 70% of the time. But what is more important is they should not go below 70. If someone is going more than 5% of the day in time below range, that is less than 70, then you have to change the therapy, because you don't want your child to go or your type 1 person to go in hypoglycemia. Then there is a time above range. Time above range, you cannot have more than 25% of the time their sugar goes more than 180. If it goes, then you have to change the therapy, you have to change the nutrition to make sure that your person is not going with more than 180. But more than 250, it is not expected and not accepted also. If someone is going even 5% of the day more than 250. Now, why somebody will go more than 250? It means he is eating, binging something which is not to be taken. Sudden some sugar is taken and suddenly your sugar is going more than 250. So that is not acceptable. That is what we educate, and we want someone to remain in time in range for more than 70%.
Thank you so much, Dr. Banshi, for highlighting the importance of glycemic control. Now, the next question is, what are the potential long-term complications associated with type 1 diabetes mellitus, and how can they be prevented or managed?
Type 1 diabetes is a severe form of diabetes. With many of our patients, they develop complications. There is a rough estimation in 15 years to 20 years, most of type 1 diabetes who are remaining under uncontrolled diabetes, they develop complications. They develop eye problem, they develop kidney problem, and to prevent them, it is a tight glycemic control is the only answer. A tight glucose control is the only answer. If they have a good control of diabetes, if they have good HbA1c every 3 months, we have a long-term data from DCCT which has shown that a tight glycemic control can prevent them to develop diabetes, microvascular complication, which is kidney problem, and retinopathy, which is eye problem. And the answer is, a tight glycemic control means how you are going to keep education, that's number one, regular insulin therapy, number two, monitoring, that is number three, and according to monitoring, they have to also take the correction dose, and for that they need a good education. That is what we provide them, and it can have a good control of diabetes along with diet and lifestyle modification, which we ask for them, and they can have a very good control for long term, and they can prevent their complications.
Lastly, can you share any recent research or developments in the field of type 1 diabetes mellitus that have captured your attention?
So two major research has happened. One is a monoclonal antibody which is approved by FDA recently last year, and that is being for prevention of type 1 diabetes. Is someone who is having autoantibody positive, who is at the risk of developing type 1 diabetes, or in the stage of where autoantibody is positive and dysglycemia is there, they can be given this monoclonal antibody to prevent diabetes or delay type 1 diabetes. That's very interesting, and it has become a news for all over the world in field of diabetes, and particularly in type 1 diabetes. Recently, one more thing has been for stem cells. Now there are more positive reports that come that even stem cells can be used with some preventive approaches which can be used for the persons with type 1 diabetes for getting them cured. So these are some of the reports which are helping our type 1 diabetes to prevent, or even now some news are coming even for cure for type 1 diabetes too.
Dr. Banshi, we truly appreciate your invaluable insights and expertise shared during this interview on type 1 diabetes mellitus. Your contribution has been immensely valuable, and we are grateful for your time and willingness to share your knowledge on this important topic.
Thank you, Dr. Nigar. I also equally enjoyed your talk.
Thank you so much. And before we conclude, we would like to take a moment to acknowledge MedSynapse. MedSynapse is a leading platform that brings together healthcare professionals, fostering collaboration and knowledge sharing. We encourage all of you to subscribe to MedSynapse to stay updated with the engaging discussions and gain access to a wealth of knowledge from medical experts in our medical community. Don't miss out on the opportunity to expand your understanding and stay informed about the latest developments. That's it for today's podcast. Thank you for joining us. Stay tuned for our next episode. Take care and stay curious.